Looking is for me, and red. Red in color is obstetrics and gynecology. At any folder inside, you will get no tickets in the exam. You will have 4 types of tests. What do we do during our practical class when we decided make decision of tests? Do you remember it? We decided from monitor, with some groups, we decided from the list of people. We tried to make a training. So, what are these types of tests? Urgent situation, emergency. What is emergency situation in obstetrics? Preeclampsia, bleeding, uterine rupture, fetal distress. You had to repeat, yeah? And when you will read this stuff, don't forget, don't be afraid, please. Don't, how in English, think and don't remember about your possible mark. Only concentrate and read the task. I repeat again. When we prepared, we had one general rule. It should be rather short, containing more information. Thus, any word which is presented in the task, any information which is presented, is crying, pay attention to me. Did you understand me? So you will read the task, try to imagine what is the situation, write down in your list of people for yourself. Complete diagnosis by the scheme. Main diagnosis, complication of the main diagnosis, and accompanying disease. I repeat again. If it is obstetrical problem, the main diagnosis is pregnancy or stage of gestation, puerperal stage, puerperal period, pregnancy, labor. If it is labor, you had to write what is the stage of labor. If it is the first stage of labor, what is the phase of the first stage of labor? Same about the second stage of labor, active or unfit. So, you will confirm this complete diagnosis, and then you had to answer for the what is the diagnosis and what is the emergency or urgent management. Understood me?
Yes, ma'am.
Use questions which you get to prepare for final exams. It would be only according to these topics. And use practical workbook, because in practical workbook, correct answers are presented. What are changes now today? The third question may be present. Give recipe. That's why you were my student. I push you to learn more and more, to learn by heart. Meditation. Did you understand me? If you are able to write more, write more. If you remember the only drug, right? Just this only drug. Did you understand? And of course, drug name, those you had to administer it to the patient. And you had to be able to answer how long this patient should intake it, why you decided to administer. So it is emergency situation. Sometimes no possibility to use any drugs because you had to do, for example, emergency cesarean section or forceps delivery. When you will think about these possibilities, don't forget that cesarean section may be done when the fetal head is maximum on the second plane of pelvis, better upper than the second plane. If the head is lower than the second plane of pelvis, fetal head station plus 4, 5, or plus 2, 3, depending on another classification, you will have no possibility to take it out through abdomen. It would be very risky for the patient, for the fetus, because of intracranial hemorrhage. Thus, in this situation, you have possibility to make forceps delivery, vacuum delivery, or fetal destroying operation. Fetal destroying operation would be used only if the fetus is dead and not available already, because of congenital abnormality, for example. At any other cases, you will do forceps. Don't forget, it should be done, all these operations, with a full opening of the cervical canal. Understood me? In some cases, you will perform emergency. You may perform internal version of the fetus, grasping by the leg and taking out. Thus, pay attention to this moment. Would you like to repeat? how to do it. Understood me? And any intrauterine manipulation in labor will be done with full opening of the cervical canal. Don't forget, because this great mistake and rather common mistake. I will force one just now, emergency. But the opening of the cervical canal is 3 to 4 cm. Understood me? So the first is urgent problem. The next task is standard situational task, or standard situation, obstetrical or gynecological situation. It is not emergency, it is only a situation. Patient admitted with some complication, some data from your previous anamnesis, clinical findings, vaginal exam. You had to confirm diagnosis and administer treatment and propose the management. And the same, you had to be able to administer any drug which is indicated for this patient. Give recipe, understood me? Especially, would you like to remember hormonal therapy, hormonal replacement therapy, and medicamentouse treatment of endometriosis, myoma of the uterus. Do you remember? You have this table. You've got it during practical class. Agonists, antagonists, hormones, and so on and so on. So I hope you remember. And at last, I don't know how to name this task. I don't understand. Yeah, so an expectant mother has been brought into pregnant pathology department of maternity hospital with severe form of preeclampsia. Would you like to pay attention to the first sentence? Usually in the first sentence, the diagnosis is already presented. But what does it mean? You will have the same situation in your practice. If patient admitted into the hospital, somebody referred this patient to the hospital, referred with diagnosis. So, next, some analyses are presented. You had to give evaluation of these analyses. Usually I don't like this task. Hemoglobin 128, it is normal, or increased, or decreased. Not so clever task, but no, we have different types of students. You had to evaluate any lab test which is presented here, and don't not only evaluate, would be clever as a conclusion. Finish. That all these clinical findings and lab tests prove that it is really preeclampsia severe form. Did you understand me? Or, depending on the findings, results of lab tests, it is preeclampsia not of severe but other moderate, for example. Did you understand me? So, evaluate lab test and compare with primary diagnosis and give summarizing. If it is really this diagnosis, is it correct or maybe incorrect? What should I add? In some tasks, you will find index of the fetal condition in CTG. Do you remember what is the index of the fetal condition? Why I'm paying attention to it? Because I'm sure you will try to repeat CTG. Would you like to repeat CTG? Repeat it, please. Read it. CTG by physical profile, Apgar score. I told about it already. Yes. But at any foreign textbook and internet, you will not find index of the fetal condition. I don't know why. In Ukraine, we use this index. Thus, normally, it should be 0.5 to 0.9. If it is 1 and more, it means that fetus suffering from distress. Did you understand me? And the degree of distress, you may imagine, depending on the index. If it is 1, no, it is mild degree, but sometimes maybe 3.5. You may understand that it is very severe situation. You had to do something as fast as possible. So you had to be able to evaluate results of lab tests. In some tasks, you may have results. You may have histologic result of histologic exam may be present. You had to evaluate glandular cystic hyperplasia of the endometrium usually is characteristic for myoma to uterus. Patient admitted with myoma with hemorrhage and after dilatation PRTH or biopsy of the endometrium showed glandular cystic hyperplasia. It means that it is really myoma. But if it is adenomatosis, for example, atypical cells are fine. It is not myoma to uterus. We have to correlate the diagnosis. Did you understand me? Thus, you will have two diagnostic tests. And within 5 or 6 years, I don't understand what is the difference. Again, unexpected mother has been brought with acute gestational pyelonephritis at 34 weeks. So, blood test, Nichiparienko, ultrasound, CTG, basal rating is 180, index of the fetal condition 2.7. What does it mean? In primary diagnosis, she admitted pregnancy at 34th week, acute gestational pyelonephritis, and complication, fetal distress. You may be asked what to do. 34-week acute pyelonephritis and fetal distress. And you will have to make decision. Understood me? On one hand, acute pyelonephritis is contraindication for cesarean section. On another hand, fetal condition is indicated for cesarean section. Thus, you will repeat biophysical profile. You will try to improve fetal microcirculation. Check up every day, 2 days only, fetal condition, and intensive antibiotic therapy. Next day, you may rest. Next day, you may perform cesarean section, but during this day, do everything to improve fetal condition for 24 hours, for example. And antibiotics would be continued after the operation. So, the exam is finished. Understood me? You will get your good mark. Thanks. So.